Hi everyone, this is Meenakshi Ramesh from tapyourwaytohealing.com. Today, in this April Autism Awareness series of videos, I have a dear friend and a guest uh, who is going to talk about yoga and the benefits of yoga for individuals on the autism spectrum. So before I talk, we have the conversation. I want to introduce my guest. My guest's name is Nalina Tirumalai, and Nalina was a homemaker, and she was practicing yoga over the years. And while she was working in Evergreen Community College, she was using it more for her own personal health and wellness. And she noticed that yoga was helping her with her own, stress, releasing her stress, and improving the quality of her life. So she decided to pursue yoga and got into the certification program offered by Yoga Bharati. And she's a yoga instructor now. And Nalina's passion is also to do her master's in yoga therapy, to extend and expand her teaching skills, and also to hone in on have a niche on specific areas. So that's her passion. Nalina recently started working with my son. We have been seeing Nalina for the yoga lessons once a week since December of 2022. And I have to say that even within this short amount of time, I can see the benefits and the healing that it can bring to any individual, not just my son. Because when Nalina teaches yoga, I also, parallelly learn from her, and I learn so that when we come home, I'm able to model that for my son. Again, it's a very slow and a long process, but it is a process that every time we go, we are enjoying. And it really opens us at a much deeper level. And I can already feel that. So over to you, Nalina. I just
Thank you,
want to,
Meenakshi.
you're very welcome, and thank you for doing this for my channel. I
Of course,
appreciate you taking the time.
of
So,
course.
first, to begin with, let's start off with the definition of yoga. What is
Sure,
yoga?
sure. Namaste, everyone. Thank you, and thank you, Meenakshi, for inviting me. And it's really an honor to work with you and Sudarshan. It's really a great pleasure. Not only like I'm helping you, but I'm also learning a lot. I should say that. And every time you teach others, you learn a lot, right? That's what teaching is all
Yes.
about. So, first off, I want to really thank all the people, all my teachers from Yoga Bharati. The whole team is amazing, and they have guided me through thick and thin, and they are there all the time, serving the community, giving yoga lessons. Anybody can learn from them. Yoga Bharati, just Google, and then you'll find their website. They have in-person classes, they have online classes. And that said, my guru also comes from SVyasa. That is, in Bangalore, there is this college, yoga college called Vivekananda Yoga Center, Vivekananda Yoga Anusandhana Kendra. So that is the Yoga Bharati is a part of that. It's a chapter of that, and they do excellent work in teaching yoga and preparing, like you need an army of teachers to help spread yoga. So they are doing that, and my teacher, my very first guru, was from there, and I really thank her, and I'm very grateful. So yeah, let's begin about yoga. So it's yoga is an ancient discipline. It's like over 5,000 years old, and if it offers tools and techniques to reach a balanced life, like reach a balanced state within oneself, and to live in harmony with your surroundings. So there are so many sages and Upanishads, Krishna, Sri Krishna and Bhagavad Gita, they have defined yoga. So this yoga is, the way I understand, is it is like a union. It's a union where your mind and your body, your breath, everything, it coexists in one. So it is a union of that, and with you connect to the higher self. So you build muscle strength, stamina, dexterity, immunity, and stability. Basically, if you practice yoga, every day. If not every day, at least 3 to 4 times a week. It's really good. And so these some of the things, instead of me explaining it, if I just read out the gurus, sages who have defined yoga, it would be great. So Sage Patanjali, he is the one who gave out this yoga aphorisms. Okay, so he said yoga chitta vritti nirodha, that is, yoga is a cessation of thought waves. It just calms down your mind. Yoga is the mastery over senses. And Krishna in Bhagavad Gita has said, Yoga karmasu kaushalam. That means yoga is the tasks you perform throughout the day. Okay. If you maintain a relaxed and awareness in every action, that itself is yoga. That is, you will get, if you do that, you will get really efficient in your actions. So that is yoga. And um, it increases the perception. That's what I've seen. See, when you don't perceive things, you're not clear. There is no clarity, right? But as and when your perception is enhanced, you suddenly realize that so many things are clear. So that's what yoga helps in. So there's a mistake, like why yoga, why not exercise? What is difference between yoga and exercise? I can just go to the gym and just walk, run, jog. Those are also good. Those are good on the body. I mean, nobody is, there is no doubt that these are really good on the body. But yoga works on the body and mind, because there's a magic happening. Because when your awareness, your breath, and your body move in union, that's when the magic happens. So yoga works on the body and mind, but the exercise works on body alone, because you're thinking of something, listening to music, you're doing something else when you're doing that, right? So, and yoga affects the nervous system. Okay, it kicks in the parasympathetic nervous system, right? So it it gives deep rest to autonomic nervous system, but exercise works only at the muscular level. And the yoga stretches the muscles and loosens the joints, whereas the exercise contracts the muscles and does strengthen the joints. So purpose of the yoga is to decrease the breath rate. You're breathing rapidly, it's not good. So it decreases the breath rate, at the same time increasing your lung capacity. So what it results in? It results in efficient use of oxygen on each and every cell. So each and every cell of your body will use oxygen efficiently, and there is no washout effect. Like, for example, if you do yoga for 1 hour, you're like, oh my gosh, I'm dead now. You don't feel like that. You just feel regenerated. Like you feel like, okay, I feel happy, calm, light feeling you get. But with exercise, if you go for 1 hour of gym, you immediately, after the benefits of the gym is fine. After some time, you feel okay, but immediately you feel like really tired, run down. It's like you have a washout effect. So that is not there with yoga. So that said, I just want to tell you how this, the whole, the modern day life is really taxing on the body, on the body, as everybody knows. So if somebody is asking, someone said, oh, there are only 2 times I feel stressed, day and night. So you're stretched out day and night. So you have so many stresses, right? Money worries, need to succeed, exams, friends, decisions, new situations, family relationships, disagreements, all kinds, you can keep going on and on. Yeah. So stress is a sympathetic response to fight or flight, right? But relaxation invokes the parasympathetic nervous system, right? So, so what happens is parasympathetic nervous system is kicked in when you rest and digest.
Digest,
That's
yeah.
when the parasympathetic nervous system kicks in. Then sympathetic is fight or flight, right?
Right.
So the constant stress on the body is bad because it just releases stress hormones, cortisol, epinephrine, then muscles tense up. What happens when the muscles keep tensing up? You get tension headaches. Okay, it's not good. Then it increases the load on the heart. The heart has to work, harder to pump. Then it increases the blood pressure. Then it increases acid secretion in the tummy, right? So, and it all these affects the immunity. You keep falling sick often. One thing I want to point out here is once I started yoga, I would not fall sick even with cold and cough very often. Very rarely I fall sick with cold and cough. So, it even stress affects even the reproductive system also.
Right.
So everything is affected. So we have to beat this, and we have to gain upper hand over this. It's not good to have high breath rate all the time, increased pulse rate, muscle tension, periodic outbursts of anger, fear, depression, lack of concentration. The list goes on and on. So these this yeah no and all these leads to obesity, diabetes, migraines, allergies, right? So everything is linked to one another. So the integrated approach of yoga is really helpful. Practice is helpful. There are so many yoga classes these days available, online or in person. There are so many yoga teachers. Just go to anyone you trust and try out few classes and start.
Right.
So
And
this is go ahead.
So I like the more you talk about it, I look at yoga as more like a self-care tool, right, Nalina?
Yes, yes,
Because I always talk about, taking care of ourselves so that we can take better care of our children,
correct,
our family. So, this is a calling for all parents, caregivers,
correct.
on the spectrum because
Definitely,
they go through burnout all the time. And this
definitely.
is such a restorative, it's relaxing as well as restorative to the body and the mind. Yeah.
It's
Yeah.
definitely, yeah.
Yeah. Yeah.
Yeah, I totally agree. So,
Yes.
for kids who are on the spectrum, it also really helps. It helps to provide increased strength. Like sometimes you notice that they don't have too much strength on their legs, they don't have balance, they don't have coordination, flexibility. All these issues can be fixed.
Right.
A yoga teacher or yoga therapist can look at the child and see what asanas, what breathing practices, what chanting can help the child. And they can do that, start slowly, and they can build it up. And
Right.
there is definitely an effect. It can increase the social emotional skills also, I feel, and body awareness.
Right. Right.
So body awareness is less, right, on the kids with spectrum. So that can be helped. Self regulation can be helped, and focus, concentration can also be helped.
Right.
So, and when they see the teacher teaching and the caregiver also teaching, they mirror you, right?
Yeah.
When you're teaching, they mirror you. So that increases also, like, communication is what I feel.
Right.
Yeah,
Exactly. Joint attention, communication, yes, which are all, core uh, core I don't want to say deficits. You can say deficits or challenges that these kids face all the time. Yeah.
yeah,
Yeah. Yeah.
yeah.
Yeah.
So, and then one more thing, what I have noticed is it's a reduction in anxiety,
Mm-hmm.
and then impulsive behavior,
Yeah.
then obsessive, aggressive behavior,
Mm-hmm.
then self-stimulatory behaviors over
Mm-hmm.
a period of time.
Yes.
you can
Yes.
notice all these things.
Right. Right.
So
Yeah, yeah. Anything that can reduce the stress levels in the body is definitely going to have a long-term effect, because all these skill, I feel all these tools that we use, they have like a cumulative and a compounding effect. The more you
yeah,
do, it's like it just builds up over time, and I think it's all connected to the nerves, and once the nervous system is reconditioned,
correct,
I think you are able to tune in, from align the body and the mind more easily. I think with time,
correct, correct.
with my understanding, that's what I come to.
Correct, correct. When you still start learning breathing techniques and breathe properly, what happens is that the muscle memory builds up over a period of time.
Right,
Then, without your knowledge, you're breathing properly.
right, right. Yeah,
Just
yeah.
clicks in like that. You may think that, oh, he might not follow all the breathing techniques initially.
Mm,
He
mm,
is
mm,
noticing. I mean, he or she,
mm,
the child is
mm,
noticing.
mm.
He or she may not be able to do it right away, but
Right. Yeah, yeah,
over a period of time,
yeah,
they catch on.
yeah. Right, right.
So yeah,
Especially when they recognize, begin to understand that this is something that's going to help them relax. They're going to want to do it. Yeah. Yeah,
correct.
yeah. So I'm glad that you shared that, because a lot of individuals on the spectrum, because of their challenges with anxiety,
Mhm.
their balance and coordination, their fine motor and gross motor challenges, that they have challenges in pretty much every area, right?
Yeah,
So it's very easy to like try something and notice, see that okay, maybe this is not working, or it's not it's not happening yet, is to just like kind of, I think for them, parents, this is something parents and caregivers who have kids on the spectrum will know very well, is to break it down. All tasks need to, we are so constantly breaking it down for them, and yoga
correct,
is also is one of
correct,
those things where it has to be broken down and
correct.
learned for these kids. Yeah, yeah,
Definitely,
yeah,
definitely, yeah.
yeah.
Yeah, and what happens is when the caregiver and the child does the yoga together,
Mm.
the child relaxes, the caregiver also relaxes. Looking at the
Relaxing.
caregiver relaxing, the child relaxes more.
Yeah.
So there
Right,
is
right.
this feeding off each
Exactly.
other,
Yes,
happens.
yes. Yeah,
So
yeah.
yeah,
So it's
uh,
it again, it comes back to, it's good for all the caregivers to learn yoga. Yeah, it's so
correct,
you can
correct,
begin with you first, and then eventually teach your child. And then
correct, correct.
you can
Yes,
have a instructor, you can learn from instructor, both of them can learn. If your child is independent, the child can learn, or just learn
correct.
and you learn first, and then you can teach it to your child. Yeah,
Correct,
yeah,
correct.
yeah.
Here, what is important is the person who is teaching or assessing the child for the yoga is should connect with the child.
Child. Yeah.
You should find a provider who connects and make it
Mm,
a part of the team. Like
mm,
how yesterday Raji was telling, make
mm.
have a team, right?
Team.
So
Yeah,
you
yeah,
have a yoga
yeah.
therapist or a yoga teacher as a team
Part
also.
of the team. Yeah,
Yes.
yeah.
So just at least for initially,
Exactly.
until the caregiver learns, you don't have
Right,
to
right.
keep going on for years until you get the mastery
Yeah.
of it or the caregiver
Right, right,
gets the
right,
what is
right,
required. Then until then,
right.
you need to find a teacher who connects with the child, and you need to
Mm,
have a consistent schedule like practicing.
mm,
I
mm,
know that every day is not the same. Things go
mm.
here and
Yeah,
there, but
yeah.
somewhat
Mm,
consistency also helps them, the
right.
children,
Yeah.
learn properly, and then get the benefit of the practice properly. And then have
Right, right.
a practice schedule, have a practice
Mm,
place.
mm,
Not everywhere. Like
mm,
there is a yoga
mm.
place. As soon as you
Place.
go to
Mm,
that area which is
mm,
calming,
mm,
the
mm,
child, calms down kind
mm.
of thing,
Yeah.
you know.
Right, right.
So that
Yeah.
also helps. And
Mm,
throughout the day, like just take yoga breaks. Oh, let's
mm,
take a yoga break. Make it fun,
mm, mm.
you
Right,
know.
right. Like the dragon breathing. Yeah.
Yes,
So the technique that Nalina uses a lot of visuals, and then she gives us handouts of different techniques. So dragon breathing is one technique that we do like a yoga break. Whenever I see my son being stressed, I tell him, okay, let's do the dragon breathing, and then we do it. Like, and it's a fun thing, fun way to take a yoga break. Yeah,
yeah, yeah.
yeah,
Take a yoga
yeah,
break,
yeah.
and then start teaching with simple poses and breathing, nothing like complicated, you know. Simple poses and breathing is starting, and then they can't sit for a long time. So breaking into different session is a better way, and make it fun. Incorporate songs, lot of singing, you know. It doesn't matter what age. That's what I find really amazing about these kids is, right, they really respond to singing and respond to the, you know, the teacher. It's like you can see they don't hide their reaction, you know. If they are enjoying, they are enjoying. They show you.
Yeah, very true, very true.
Yeah.
Very true, Nalina. So, um, the next thing would be
Yeah.
to, I know you did talk about the effect of yoga on the nervous system. So a lot of individuals on the spectrum have anxiety related issues. So if you can show some poses that will help
Yeah.
them, maybe a couple of poses,
Yeah, definitely.
that will help with the
Definitely.
anxiety, that will be great. Yeah.
Definitely. You can start with, see, any poses which is forward bending. Okay. Calms, increases the blood flow to the head. It calms the mind. There is also one pose, the easiest pose is Shavasana. That is just lying down like a corpse. Legs have to be, let me just, do you want me to demonstrate right now?
Yes,
Yeah.
that will be
Okay,
great.
let me do that. You can see the mat over there. I'm going to move my chair.
Yes, I can see it. Yeah.
Okay. You can see the mat, right? It's clear?
Yes, I can. It's
Okay.
clear. It's very clear. Yeah.
So this is Shavasana breathing is just lie down, hands away from each other, from your body, palms facing up, and legs away from the body. Heels of the legs are just facing each other. Everything on the floor, from top to bottom, everything.
Okay.
Your back is on the floor, your bottoms on the floor, your thighs, legs, everything is touching on the floor, and just breathing. When you breathe in, your tummy just goes up. Breathe out. Completely goes in. It's balloon breathing. Initially, they will have difficulty doing this. Okay, but over the time, you can just keep a boat, keep a paper boat on the tummy, keep a balloon on the tummy. Tell them that you're going to blow like a beach ball. They all know what beach ball is. So this is the most simplest thing you can do. Okay. The rest, if they can stand erect, just make sure that you have a wall, because many of them cannot stand erect. Just make sure the back, the buttocks, the head, everything is touching, and just make sure that they are standing straight.
Okay.
And they breathe.
Okay.
Simple things like that. Okay.
Okay.
And there are other asanas which are there, which reduces anxiety. One is this Shashankasana. It's a child pose. I will show you right now. I'm just showing you the pictures. Okay. This is the child pose.
Okay.
So you have to, many kids cannot do that initially. So what you have to do is you have to make sure that you have a cushion. Okay. And just sit. And keep the cushion behind and make them sit like that.
Right.
They can sit.
That's what I do with my son. Yeah.
So wonderful. If they can sit like this, wonderful. Otherwise, keep a cushion and make them take their hands behind. Breathe in, back, breathe out, come front. Okay. And stay here. If they can't take their hands back for some reason, just let them take their hands all the way up and come.
Okay.
Either works, because there's extra blood flowing when you are bending down. Right. And it works. It just calms them. And with this, if they can chant Om, that will be the greatest. If they can chant Om, so many kids cannot chant Om.
Okay.
So you can make them listen to Om.
Yeah. Yeah.
That is one technique. Or if they can chant, just inhale. Most of them can do or ooh, or just bumblebee. Just breathe in. In that child position, if you chant the bumblebee, the mind completely calms down. Or even in Shavasana, in the lying down position, if you chant bumblebee, like breathe in first. Like that, just it calms down. Or if they can't do any of those, just play the Om recording.
Okay.
Any of the other chants. There are so many chants, Mahamrityunjaya mantra. Then there are other chants which are available online. Just play them and let them listen to it. Even soft, if they can't take too much of sound, right? Volume, just soft things. They should be aware, and over a period of time, they will definitely learn. Even they can. So what I've observed, Sudarshan, is initially he couldn't say the prayer. Now he says the
Right.
prayer.
Right. Yeah. Yeah. And we also use the chants. We have Nalina
Right.
has recorded some chants for us, and we
Yeah.
use it every day. Even sometimes during yoga, practicing yoga, we just I have him sit and listen, and that
Yeah.
gets him into the routine of listening to the chants. Yeah.
Yeah.
Yeah. That's awesome,
So
Nalina.
these are some of the techniques. And there is one more. I can show you one more to reduce the anxiety is back bending and forward bending. So you have to start. Let's see. Okay. Inhale, take your hands up.
Nalina, I'm not able to see your face, but I'm able to see you. So if you
Okay.
can adjust, yeah, yeah, yeah.
Now better?
Yes.
Yeah.
Perfect.
Inhale, take your hands up and bend back as possible. And then exhale, come down. Wherever your hand lands, it doesn't need to land on your feet. It can land on your thigh. Wherever it lands, is fine. You can even bend your knees, soften it a little bit, and try to bend also is fine.
Okay.
Okay. So that can practice up and down, up and down.
Up and down. Perfect. Perfect.
Okay. If
That's
the back,
doable. Yeah.
only if the back doesn't hurt. Okay. So these are some of the asanas which can be used. These two work great. Shavasana and this child pose work really good.
Right. Right.
And even the forward bending, like for example, you can sit down on the floor and Paschimottanasana. That means you are forward bending. Right. First, you inhale, take your hands up. Exhale, bend forward from your hips, wherever your hands can land.
Okay. Okay.
And up. Inhale and exhale.
Perfect.
Those can. And what I see is whenever possible, make the child sit on the floor. Even everybody actually has to sit on the floor. It really helps the relieves tension on the back muscles. If you sit on the chair, it's not very natural for us to sit on the chair all the time. Sitting on the floor kicks in some of the muscles on the on our legs, so relieving the tension on the back. So it helps to whenever watching TV, sit on the floor and for some time. Obviously, we can't sit all the time, but sometime during the day, sit on the floor. It helps. So yeah,
That's good to
these
remember.
are the
Yeah.
things.
Just good old practice.
I know
The times that we used to sit down and eat back
exactly,
home. Yeah. Definitely.
exactly,
It's all good practice. Yeah.
exactly,
Missing all that now after dining
exactly.
tables. Yeah.
And there
Yeah.
are some asanas to improve the balance. That is something which you can do very easily. Like you can stand. Suddenly if you start off with the tree pose, they will all fall. So what we have to do is I'll just only concentrate on the legs, because stand straight like this and just kick your feet. Inhale like that, both feet.
Okay.
Like that. And
Okay.
sides.
Okay.
Inhale, exhale. Inhale, exhale. So this will
Hmm.
help with a little bit of balance. And then they can start the tree pose. Inhale, they can start like this. See, I am balancing, but slowly I'm learning. Then slowly after that, they can graduate here.
Okay.
Not on the knee, because if you
Okay.
put your other leg on the knee can hurt. Slowly they can graduate here. And slowly they can also graduate later over here.
Okay. Okay. Perfect. Yeah.
So some of the balancing asanas, balancing asanas also improves the focus, the concentration. Because when you want to balance, you need to,
Focus.
watch a point or concentrate. So that helps to concentrate also.
Okay.
So, and then even sitting down, stretching your legs and make a butterfly pose. That also helps to expand these, give strength to the muscles over here.
Yeah.
Just sit like this or sit like this. And just do butterfly every day. This is the easy enough asanas. You can even put a cushion or you get a yoga block. You can sit on it, yoga block, or a plank, anything, just to raise so that the legs completely go down, and you can practice the
butterfly.
Butterfly.
Yeah.
You can sing songs when they're practicing. Play songs. There are so many songs on the internet. It's unbelievable treasure if you find and download some of the songs. You can play them and
So the next thing I wanted to mainly ask you was, Nalina, a lot of individuals on the spectrum, they have issues with in their gut, digestion related issues. So if we can demonstrate some poses that help with digestion.
Definitely. See, some of the asanas have dual benefits. Like the one I told you, the Paschimottanasana, where you're forward bending and sitting, that helps with digestion.
Okay.
Over a period of time. If you keep doing that every day over a period of time, it helps. This one, this is the Vajrasana, where I think I showed you are sitting down.
Right. Yes. That helps.
This one helps after you eat a meal. If you sit like this, it helps with digestion.
Okay.
So 5 minutes, after 5-10 minutes after the meal, if you sit like this, it helps. And there is another asana which I'll show you, which helps with the digestion is, but this cannot be practiced just after the meal. Okay. So this is with the regular practice, you can practice. You can see me correctly, right? Yeah. Okay.
Yes.
So for this, lie down. First, you take your right leg. This is Pavana Muktasana. Inhale, take your right leg up. Exhale and hug your thigh. Hug your leg. Okay. And with the other leg, you can make rotations.
Okay.
If you want. If the child can follow. Otherwise, just this is fine.
Okay.
And after some time, just inhale and exhale. Again with the other leg. Inhale, hug. Rotations if possible. If not, just leave it. Inhale, exhale. Now, take both. Fold, hug. Really good. And you can just rock a little here. It's a good massage for the spine. And after that, inhale again, exhale, and then make sure that you make them turn on one side and then make them get up.
Perfect. Yeah, these are all asanas that Nalina has taught my son too. And
Yeah,
as you watch Nalina demonstrate, it seems to come very easily and effortlessly for her. But what for the others, it will take a lot of
it
practice.
does. It
It
does.
comes eventually. That's what Nalina reassures every time. It will come eventually.
Correct.
But just we need to diligently give it a few minutes at a time and take yoga breaks and practice, and which will lead us to flexibility as well. Yeah.
Yeah, there is one more asana I want to, good for digestion. It also
Sure.
not only good for digestion, it's good for building back strength.
Hmm.
So that, and it can also strengthen abdomen, like it can reduce the fat in the abdomen. That is called bridge pose, Setu Bandhasana.
Okay.
Okay, so that is, you just have to again lie down. You can practice this after you finish your this pose.
Hmm.
Okay. So for that,
Hmm.
hold your knees for Setu Bandhasana.
Hmm.
Keep your hands next to you, palm facing down, and inhale up
Hmm. Wow. Hmm.
and exhale down. You can repeat this 4-5 times. Inhale up.
Hmm.
Here the chin is touching the chest, so it's really good for thyroid
Hmm.
stimulation,
Mhm.
and it's good to reduce the belly fat. It
Hmm.
also helps to strengthen the back and good for digestion.
Right.
The 4 benefits of this asana. And you can stay here for 5, 4, 3, 2, 1, and down.
Awesome. Awesome, Nalina.
So those are the, so whenever you get up, I get up because I'm used to it, but you just turn on one side and
Hmm.
get up. That's
Okay.
until you're completely used to it. Every day if you practice yoga, then your back strength is pretty good and you can get up.
Perfect. So, and then when is the best time to practice yoga?
Yeah. So just after eating, should not practice. Mornings or evenings, the very best time when it's calm down. And 3 to 4 hours after eating is good, but practically it's not, for everybody, it doesn't work that way.
Right. Right.
So at least 2 hours, 2.5 hours
Okay.
after eating is better to practice.
Mhm.
Breathing exercises can be finished off in the morning
Hmm.
or in the evening.
Hmm.
Pranayama,
Hmm.
pranayama also I want to talk about.
Hmm.
So that can be done. And especially kids on the spectrum, right? Take small breaks. Like you cannot do for them,
Like a
early in the
30-minute
morning.
session. Yeah. Yeah.
Early in the morning, it may not work out.
Hmm.
In the evening, it may work out. Maybe morning, it may not work out. So depending on the mood, because each day it may be different. So find a good time. Just make sure that they are not eaten right away,
Hmm.
and
Right.
just start the practice. Just 10 minutes, give a break, and then, 10 minutes, find time which is suitable. But usually for others, early morning or evening is the best time to practice. That is after 3 to 4 hours after the meal.
Perfect. Perfect. You can have your seat, Nalina, and then
Yeah.
yeah, talk about pranayama. You said you wanted to share something about
Yeah.
pranayama.
So pranayama and chanting also is really helpful for everyone, and especially for the kids on the spectrum. So here, what happens is you're doing the breathing alone, sitting with your back, neck, and head erect. Anytime, anywhere. You can sit in Vajrasana like this. You can sit, many kids I find they cannot sit, their backs get hunched. So
Yeah.
find a proper support on the wall or give them a plank so that their back straight. Once you put a plank on it, if they sit on the plank, their back is a little bit straight. Do that, and then you can just start with simple breathing. The balloon breathing, then dragon breathing. The dragon breathing is nothing but like a breathe like a dragon. Inhale through the nose, exhale through the mouth. That can be done because it's simple enough, they can follow. If I ask them, you're going to inhale only through the nose, exhale only through the nose, they may not be able to do it right away. To make it very simple for them so they can follow, they can feel good about it. When they follow, they say, oh, I did it. They should feel good about it.
Yes.
Then they
Yes.
can advance to the more things. Like the next thing they can practice is sitting down and just doing bumblebee breathing. Like inhale, and as they exhale, make a sound. Hmm. Immediately, when you make that bumblebee sound, if you notice, your tongue touches the upper palate. It automatically happens. You don't have to, physically do that. Hmm. Hmm. You can hold chin mudra like this if they can hold. Otherwise, just palms on the, thighs, more than enough. Just breathe like that. Or if they can follow over a period of time, they can even do anulom vilom. See, there are energy channels throughout the body according to the yogic um, you know uh, yogic sciences. There is all the energy channels which are not physically visible, they are subtle channels. Okay, there is ida channel and this pingala, both have to balance. Okay, that's when there is health in the body. If you want to be healthy, there has to be energy exchange between ida pingala, everything has to be balanced. So this is one of the best for giving a nice balance to the nadis. It's called nadi shodhan. So you have to you might have noticed some of the men do this during sandhya vandana.
Yes.
So this is very hard for the kids to get, doing this mudra. So you can even just close left nostril, breathe out, breathe in, close the left nostril, breathe out, breathe in, breathe out, breathe in. This is advanced, a little bit advanced, obviously.
Gotcha. Yeah. Yeah.
So that can be done. And there are so many other pranayamas. So over a period of time, yeah, that can be taught.
Awesome, awesome, Narina. This has been a great, great,
Thank
interesting,
you.
and I learned a lot. Of course, I get to see you, meet you every week.
Yeah.
But do you want, if you want to share anything, final thoughts, comments, anything that you would like the parents and caregivers and the kids to know, please share.
Yeah. Yeah, it is just don't give up. That's all
Yeah.
tell you. Like just take them to one session and they say nothing is working, then just, you know, don't give up like that. This takes time. It is really once the kids gets the hang of it, build a relationship with the yoga teacher or the therapist. It really works, and it's helpful for the caregiver, also for the child. So just keep practicing, and you will see the benefits of yoga. And I have healed myself. I had severe back pains, I healed that. And many of my friends tell stories how they have healed migraines also, their own conditions. So many people have healed conditions. That's the reason they come into this, with passion. So I know
Because it
some.
helped them first. Yeah. Yeah.
Yeah.
Awesome.
So I know a person who has said that, who told that they, with regular practice of yoga, they even healed their breast cancer. Like they did go through surgery, but after that they, they didn't want it to come back. So with a lot of yogic practices, they made sure they're healthy even after 15 years. So this really works if you can follow it. Yeah.
Yeah.
It's
Yeah.
not hard. You
My
feel good after doing it. So that
right,
is
right.
the right away, there is a reward. See, that is you don't have to wait. As soon
Right.
as you finish it, you feel good. So it's,
Good, feel good. Yeah,
yeah.
yeah, yeah. I agree. I agree. And yeah, it's just, keeping up with it and trying to embrace it and integrate it as part of our life, it's all about integrating it. Learning is one
Yeah.
thing, and
Yeah.
then, how you integrate it into your life is the
Yeah.
other
Yeah.
thing. Yeah,
Yeah.
yeah. Thank you so much, Nalina,
Yeah,
for
of
sharing
course.
and demonstrating. And if people want to contact Nalina, they
Yeah,
could
yeah.
reach out to me, and you can share your email, Nalina, if
Sure,
people want
sure,
to
sure.
reach out to you. Share your say your
Sure.
email.
It's my first name, Nalina@gmail.com.
Oh,
NALINA@gmail.com.
okay, perfect. And you can also reach out to me, and I can share Nalina's information with
Definitely.
you.
Yeah,
Okay.
definitely. Thank
Thank
you
you
so
so
much.
much.
You're doing a
Thank you.
wonderful
Thanks.
job, Meenakshi. I really enjoy all the conversation you've had on this, this Autistic Awareness Month. It has been a pleasure just watching all the videos. So
Thank you.
great
Thank you,
job.
Nalina. So thank you so much for saying that.